Over the last couple of years, I have spent an enormous amount of time in hospitals. I mean enormous. I'm talking 5 to 6 hours a day for nearly 2 years, which unfortunately didn't end well. But what I learned while I was there scares the daylights out of me about today's healthcare system. I've done a few posts about the things I've seen and some of the suggestions I've had in previously, but one of the simplest changes that I think needs to be made in our healthcare system is hospitals need to be 24/7 operation. Now I know you may be saying, well, all hospitals are 24/7. Believe me, they are not 24/7. I have spent time in just about every type of hospital, big ones, small ones, nursing homes. The care that you get on a Friday night through Monday morning is nowhere near as good as the care you get from Monday through Friday between 9 and 5 o'clock. Isn't that sad? I would hate to have an emergency operation on a Friday night, because you will spend your entire weekend in a ghost town because they don't have the same level of care. Not as many doctors come by, not as many nurses come by. Even things like the food in the cafeteria, the cleaning staff, the cleanliness of the hallways, of the bathrooms, of the rooms, the linens. There's so many things that are not being taken care of on the nighttime, at nighttime, on the weekend. And that is sad. Hospitals, in fact, I've been to some hospitals, quite a few of them, where after, let's say 8 o'clock, not only do they have virtually nobody walking in most of the hallways, but they lock the front door. They literally lock the front door. And this is not just one hospital. I've been to several. They lock the door, which means that, they pretty much, emergency room, you get in and you do whatever you do there. And believe me, those are more or less staffed very well 24/7, although still not as well as they are during the daytime and not as well as they do midweek, but they do have a constant staff, and I have been given a great lesson in watching, a good teamwork even at off hours. I've been in nursing homes, in ICUs, and in some trauma centers in 3 o'clock in the morning, and I've seen miracles. But still, it's not quite as well staffed. If they have 2 people who need something in the middle of the night, really not equipped to do it in some cases, if they really need that level of care. So for today's idea today, look, there's a lot of money going into healthcare. There needs to be a more of a focus on giving better healthcare on weekends and evenings. There are a lot of people getting very poor treatment just because it happens to be nighttime, just because it happens to be the weekend. So that is today's idea of the day.
Could you please subscribe to my channel? I'm a new channel and I don't have anything. And I don't need anything except maybe this chair. And that's all. I only need this chair. It's all I need. Maybe the paddleball game. That's it. The chair and the paddleball game. I don't need anything. I don't need subscribers. Maybe this remote control and the ashtray, and that's all. The chair, the paddleball game, remote control, the ashtray, and this lamp. That's it. That's all I need. And maybe I need subscribers, because could you please subscribe?